8 years ago, I had heart bypass surgery. And about 2 years ago, I'd gotten to the point where I couldn't walk across the backyard without having to stop because of chest pains and shortness of breath.
We did a stress test on him and noticed that he did have an abnormality. We did an echo and we noticed that his aortic valve was getting more and more calcified and narrowed. So we faced a little bit of a dilemma. What's the right thing to do at age 85 or 86 for somebody who's gradually aging their heart?
One of the problems that we encountered with him is that during the initial operation, his heart and some of the bypasses became adherent or stuck to the chest wall, which really made a redo operation a very risky procedure.
So we felt that opening his heart was really not an option.
It was just about ruled out, so it was just as a last resort.
So we're left with a man who's otherwise thinking well, working, wanting to do things, but his aortic valve is gradually getting to the point that he can't do anything.
Dr. Zadar had been following this new procedure for some few years that was being done in Europe.
This is a way to replace the aortic valve without arresting the heart and cutting open the middle of the chest and putting a new valve in.
A pretty amazing technological advance when you consider you can replace an aortic valve now without opening the chest or putting them on a heart-lung machine.
So this is something that just got approved in the United States within the last 18 months.
When the TAVR valve became available for us in our community, it opened the door for patients who were either inoperable or very high risk.
I find that older patients who are thinking of undergoing a big procedure do the best if they're in the best shape they can be and if they are motivated mentally. They have some goal to get to.
Our granddaughter decided to get married in Boston. We had planned on going, but it was sort of doubtful whether I'd be able to go because of my shortness of breath and heart problem.
He was a very motivated man. He wanted to go to his granddaughter's wedding, and he said, if you get me through this procedure, I'll get the rehab done and I'm going to make it to that wedding and I'm going to dance in her wedding. And he never lost that vision.
30 days after the operation, we took a trip to Boston. And I did dance with my granddaughter at her wedding reception dinner. Since the surgery, I have had no heart pains, no shortness of breath. I feel like that I got a new lease on life.